Anxiety is not just mental. There is a biochemical piece, there's a hormonal piece, most likely, and there can be a spiritual piece as well. So, there was an interesting study that stated given the chronic course of anxiety disorders, it is regrettable that there are almost no controlled studies that investigate treatment periods over 12 months. So they might want to keep you on it for 10 years, but we don't know what the long-term issues are going to be because there's been no actual studies done, right? And so a lot of times I've seen patients come back in and say, well, it used to work, but now it's not working anymore, but now I can't stop it because my body is dependent on it. And so then not only do we have to deal with the original imbalance, but now we have to deal with the medication-induced imbalance as well. And so that just kind of compounds the problem. So I'm thrilled you're here with us on The Christian Clinician, where we join faith with evidence-based medicine to revitalize your health and renew your faith. Get ready for real and informative conversations with wellness experts and Christian scholars alike to gain a deeper understanding of our faith, explore our God-given purpose, and discover how the strength of our relationship with God can impact our health here on earth. Hello, and welcome to another episode of The Christian Clinician. I'm your host, Dr. Tanya Paynter, and we're going to be talking all things anxiety today. So there was a time in my life not too long ago where I was doing all the right things. I was praying, I was reading scripture, I was going to church regularly, super involved, trying to fellowship, and the anxiety still wouldn't go away. Now, maybe you've been told it's just in your head, or that you need to trust God more, or you just need to pray more. But the truth is that anxiety isn't just a mental struggle. It is a signal, a message from your body, from your brain, and even from your spirit that something deeper needs your attention. So it could be hormones, could be blood sugar, could be your gut, could be past traumas, or maybe it's the pressure of trying to hold everything together and be the perfect Christian wife and mother. But we weren't designed to live in survival mode. Yet for so many of us Christian women, anxiety has actually become the new normal, but it shouldn't be. And in this episode, we're going to get real about what anxiety actually is, what's happening in our brain, in our body, what is affecting our neurochemistry, and how God meets us. We're going to explore both the science and the spirit because you don't have to choose between faith and physiology. God created your body and your brain, and He has a plan for your healing. So I saw a Facebook question the other day that asked how to stop worrying in a practical way. They went on to say that they know that they're not supposed to worry about things and instead just present a request to God, but that never really helped. And the response was to pray and how to pray and praying more. And the response to that was, well, how exactly do you pray? Because I feel like my prayers don't make a difference. They don't alleviate my worry. It just feels like it doesn't do anything. And I was there for a long time. Was at the point where I felt anxiety pretty much 24/7. I never really felt good. I've never been an anxious person. So this was really weird to me that all of a sudden I started having a lot of anxiety. And so I was trying to just immerse myself in biblical, scriptural, spiritual activities, relying on God to pull me out of it. And yet there were things that I was doing that was keeping my body in this cycle of anxiety. And now I'm happy to say that I am free from that, except for very rare occasions where, again, it is just a signal from your body that something isn't right. And it's not necessarily just that we're not praying well. So let's look at what anxiety is. The clinical definition in the National Institute of Health defines anxiety disorders as anxiety that does not go away, is felt in many situations, or it gets worse over time. So the statistic is that about a third of US teens and adults experience an anxiety disorder at some point, not just generalized anxiety, but a disorder. So symptoms that are interfering with daily life, routine activities like job performance, schoolwork, relationships. And then there are the severe cases where someone might feel intense fear in common situations, avoid social encounters, refuse to leave their home. That's where it becomes disabling. But even if you don't have a diagnosed disorder, symptoms of anxiety are very common, especially in middle-aged women. And so we're going to kind of unpack what that looks like. So if you have actually been diagnosed with an anxiety disorder, that would be something like panic disorder, social anxiety, various phobia-related disorders. And then there's just kind of the catch-all that is generalized anxiety, and that's called generalized anxiety disorder.
So there is a difference between healthy alertness, anxiety that we were meant to feel in stressful situations. That's kind of a built-in survival mechanism that God provided to our bodies when we're presented with a stressful situation. But this is mostly supposed to keep us alive, right? The stressful situation is running away from the bear, or, if we're being attacked, that we can defend ourselves and flee to safety, things like that. But we tend to live in that state all the time now. Things like electronics, EMF exposure has been linked with increased anxiety levels. We have a very stressful lifestyle. We're running our kids all over the place. We've got a ton of responsibilities. We've maybe overstressed ourselves a little bit, right? Because we don't want to be seen as lazy. We want to make sure that we're doing all the things that a good wife and mother does. And that leaves very little self-care time. And so we tend to live in a very high stress, high paced society that expects a lot from us. And we in turn have learned to expect a lot from ourselves. And so this can contribute to imbalances physiologically that I'll go over in a few minutes. But we really need to differentiate between healthy anxiety and chronic dysfunctional anxiety. And so, if you are living in a place of anxiety all the time, you wake up, you're feeling anxious at 2, 3 in the morning, you wake up first thing in the morning, and the first thing that pops into your head is an anxious thought about something, right? That's where I was for a while. And that is a chronic dysfunctional anxiety. And so, we need to look at some of the things that are causing that. What's causing it? So, let's take a look at our brain and neurochemistry. So, the way that anxiety works is that your brain decides that something is a threat. When we've decided that, and this is often a subconscious decision, it will trigger a response in part of the brain called the amygdala. And that's the part that is responsible for processing emotions and behavior. And it helps to regulate anxiety, aggression, fear. So this is the piece of our brain that is really involved in that anxiety. So the amygdala will trigger the fight or flight response by triggering another part of the brain called the hypothalamus. So once we've decided that something is a threat, the amygdala kicks in gear, and then the amygdala will trigger the hypothalamus. And so the hypothalamus is actually a major communication center. It's like a command center in the brain that communicates with the rest of the body through the nervous system so that it gives energy to the body and it shuts down systems that shouldn't be involved in a acute stress situation. So like we don't need digestion, we don't need an immune response when we're faced with fight or flight, right? When we're in extreme danger, that stuff shuts down. And instead, we need increased blood sugar, increased blood pressure, increased heart rate, increased ability to breathe. Those things are all upregulated. And so that's known as the fight or flight. So over time, when we are overly stressed, this leads to dysfunction in that hypothalamus. And we start seeing that our ability to manage and handle stress decreases over time. It disrupts immune function, it increases inflammation, increases our risk for autoimmune diseases. It can contribute to mental health disorders like mood disorders, anxiety disorders, PTSD, things like that. It can contribute to metabolic diseases like diabetes and cancer, cardiovascular diseases like hypertension and or high blood pressure, and then contributes to hormone dysregulation, so hormonal issues. We also can see some neurotransmitter imbalances coming from this chronic stress. So some of our neurotransmitters, so these are the hormones and other biochemical messengers that transmit signals from the brain into the rest of the body. So GABA is one. When we have low GABA, we have a poor calming response. We're not able to calm down as much. Low serotonin, same thing. Serotonin is the neurotransmitter responsible for GI motility. It helps with the sleep wake cycle, and it helps us to feel calm and happy and all of those things. And so when it's dysregulated, when we're low, we can see low serotonin contributing to anxiety. We can see low dopamine issues. So this would look like a lack of motivation. So when we're just kind of like, oh, I just feel like I have no energy to do anything. I just want to sit here on the couch all day long. That might be a low dopamine issue. Chronic stress will contribute to low dopamine because dopamine will convert into adrenaline. And so when we're under chronic stress, our adrenaline is higher than it should be. So the adrenaline will contribute to anxiety, as will the low dopamine. And then we see high norepinephrine. So again, this is related to the adrenaline. So norepinephrine is also called noradrenaline. So it's the step before adrenaline is formed. So it contributes to the fight or flight reaction. It increases blood pressure and heart rate. It contributes to blood sugar dysregulation, lowered immunity. Like there's a lot of things that it can contribute to. And so we can see a lot of neurotransmitter imbalances that can be a physical reason why we're having anxiety. And so the neurotransmitters can be affected for multiple reasons. So let's go a step further back from that. So, what can cause some of these neurotransmitter imbalances? Hormone imbalances. So, the brain is very responsive to changes in estrogen and progesterone. It's one of the reasons why anxiety is so tied into our cycle, if you've noticed that. We see activity of the GABA system. So, again, that GABA neurotransmitter that changes during hormonal fluctuations through the month. Low progesterone levels will lead to lower GABA levels, which, as I just mentioned, increases anxiety. That's one of the reasons why, if our hormones are balanced well, we tend to feel more calm during the second half of our cycle. And we stress out easier during the first half of the cycle. Now, this is in a balanced person. However, if our progesterone is too low, we actually might see worse mood, worse anxiety, worse ability to handle stress in the second half of our cycle because we have too much estrogen and not enough progesterone. So if you have issues in the first half of your cycle, then that can be from, again, low progesterone. It could be from high estrogen. If you see worse moods in the second half of your cycle, or if your anxiety really spikes, that's usually a result of low progesterone. And then estrogen dominance. So this is a very common occurrence in women is that we have estrogen, we have too much estrogen, not enough progesterone. And again, this comes back to chronic stress. When we're under chronic stress, we tend to drain our ability to make progesterone. And so it favors the estrogen pathway. So we produce more estrogen and less progesterone. More estrogen will stimulate certain receptors that increase irritability, tension, incapacity to handle stress, but it also can contribute to anxiety. And then conversely, low estrogen can also cause anxiety. So that's fun. Like too much, too little, everything causes anxiety. So then we have cortisol dysregulation that can occur from chronic stress. So cortisol is a stress hormone that helps to regulate the sleep-wake cycle and is helps to manage stress levels. So it regulates blood sugar, helps in the short term, it helps to decrease inflammation. It helps to regulate our metabolism. It helps in blood pressure. It plays a role in the sleep-wake cycle. So this is a really important hormone. When we have chronic high stress, well, when we have high stress in general, it kicks in when the adrenaline is released. So the adrenaline will cause the adrenals to put out more cortisol in order to maintain that fight or flight, and it will inhibit our rest and digest. It's our relaxation mode. And so when we're under high stress, the cortisol kicks in and inhibits our rest and digest mode. So then we're stuck in that sympathetic piece, in that fight or flight piece. And so acutely, if this is like a situation that lasts an hour, then great, like it does what it's supposed to do. And then as soon as the stressor is removed, then you kind of go back into your normal rest and digest mode and everything comes back to normal. That's ideal. What usually happens though is that our high stress just continues day in and day out because we've got places to be and things to do and responsibilities, and there's the bills, and then there's all the errands and the shopping and the cleaning and the cooking and the. And so when we have all of that stress on a constant basis, then the cortisol will continue to pump out every day. We start having problems sleeping because it's not decreasing the way it's supposed to. We start seeing an increase in inflammation because our body starts to get used to the presence of cortisol, so it loses that anti-inflammatory ability. That tends to weaken the immune system, starts to increase our blood pressure on a constant basis. And so then we start seeing, some of these longer term effects of chronic stress. And again, when we see that happening, it's changing our neurotransmitter pattern. It's changing our hormones, which again is contributing to that hormone to neurotransmitter imbalance. And so then we start seeing anxiety rearing its ugly head. So there is a quick way to test if your parasympathetics are working well or if you're kind of stuck in that fight or flight. There's kind of two little tests that we can do right now. You can pause this this episode and you can try this. So the first is the heart rate variability. So this is testing to see how much your heart rate changes as you breathe in and breathe out. So if this is something that you have a hard time doing or you feel really dizzy when you do, don't do it. But if that is the case for you, then you are actually not breathing properly. You're not getting enough oxygen, which guess what? Can cause anxiety. So if you do this little exercise and you start feeling lightheaded or dizzy or, kind of weird, then that tells me that you're not getting enough oxygen through the day. That might be contributing to your anxiety. So just a little side note. However, so you're going to find your pulse, ideally in your carotid artery, so in your neck. You can do it wherever you can feel a good, strong pulse. You really need to be able to feel it pretty well. And you're going to breathe in for 10 seconds, and you should feel your heart rate speeding up. So as we're breathing in, it should stimulate your heart to increase its rate per minute. And so you hit that 10-second mark and you breathe out for 10 seconds. And you should, by the end of that 10 seconds, you should feel your heart slowing down again. And so you should be able to actually feel a difference. If you can't, you can hook yourself up to a heart rate monitor and you can actually, watch it. If that's easier, that's absolutely fine. But really what we want to do is we want to see how much it's changing. So if it increases by, 10, 15 beats a minute when you're breathing in, and then it drops, 10, 15 a minute when you exhale, that's really good parasympathetic tone. So that means that you're not stuck in fight or flight. So good for you. Congratulations. It's wonderful. Now, if you try doing this and you're like, I don't know, it doesn't seem like it's doing anything at all, then there's a second way that you can try is to look at what your resting heart rate is doing. So whatever the number is, say it's 70. You take a deep breath and you hold it for about 20 seconds. And then you want to notice how high your heart rate increases. And then as you exhale, if your heart rate drops back down to your resting heart rate pretty quickly, then again, we know that the parasympathetic nervous system is working pretty well. But if you inhale and your heart rate jumps up and stays high and it doesn't drop back down, then that tells us that your body is in a higher state of stress and your parasympathetic, your rest and digest system is not doing what it's supposed to do. And we'll talk about ways that we can kind of help to trigger that a little bit. All right, and then finally, we want to take a look at, thyroid dysfunction. So this is another very common reason for increased anxiety. So there have been a couple of studies recently that have linked hypothyroidism to anxiety. We've known for a long time that high thyroid function or hyperthyroidism will trigger anxiety. That's actually a common diagnostic symptom that we will use in the thyroid, hyperthyroid piece. However, hypothyroid, they correlated higher TSH levels with more severe panic attacks in people who struggled with this. And so TSH it's just a simple blood test that you can have done. And if you're falling outside of that normal range, if you're elevated, then that might be a contributing underlying factor to your anxiety. And there was another study done with patients struggling with Hashimoto's, which is also known as autoimmune thyroiditis. And they exhibited an increased chance of developing depression and anxiety or of receiving a diagnosis of depression or anxiety disorders. So we know that thyroid is implicated in chronic anxiety as well. So then we have some biochemical triggers. One of them is blood sugar instability. So if we have spikes and crashes of blood sugar, can lead to anxiety. If we have a disrupted gut microbiome, if the bacteria in our gut is not where it should be, it can increase inflammation and is contributing to brain fog and anxiety. Histamine intolerance, where we see excessive histamine, that can cause an overstimulation of the nervous system and can lead to anxiety. And nutrient deficiencies like B6, magnesium, omega-3 fatty acids, zinc, all of these things can impact neurotransmitter function, which, as I mentioned at the beginning, can contribute to anxiety. Then there's also dietary triggers. So these are probably one of the first places to start. If you are a person who indulges in some of these things or maybe have a little bit more than ideal, then this can be a very easy way to step in and start changing not only your nutrient profile, but your gut flora and as well cutting out potential anxiety triggers. So before I mention these, this is really important to, I've mentioned in previous episodes As we start tracking our symptoms and understanding a little bit more about what triggers things for us and how our body is responding to things that we're doing that we have control over, can really be helpful in starting to understand and peel away the things that are contributing to that overall anxiety level. So we really want to do some investigation and looking at ways that we can immediately impact our health and our anxiety. So, dietary triggers, anything that contributes to an imbalanced blood sugar. So, not only does stress contribute to anxiety, but dietary things can also increase blood sugar that leads to anxiety. So, we've got it from a couple different angles. So, high sugar foods or eating a lot of sugar through the day, processed foods, refined carbs, fast foods, these kinds of things can contribute to our blood sugar going up and down and contributing to that anxiety piece, especially if you notice that you're on kind of a roller coaster. Fried foods and fast foods are another trigger for anxiety. And there are a lot of chemicals in certain types of fast foods, the way that it's cooked, the oils that are used, all of those things can contribute. Caffeine, this is a really well-known trigger for anxiety, probably one that you've heard of. And so for a lot of people that I know, their breakfast is a big cup of coffee. And that is going to set them up, if they struggle with anxiety, that's going to set them up for increased anxiety through the day. So it would be much better to eat food first and then have your big cup of coffee if you want to. We want to make sure that we're helping to support how our body is absorbing, utilizing that caffeine, and caffeine can contribute to blood sugar dysregulation as well. As well as caffeine also is known to increase our catecholamine neurotransmitters, so our epinephrine, norepinephrine, or adrenaline, noradrenaline, whichever you prefer to call it. And it also increases our cortisol. So if we're already struggling with high adrenaline, noradrenaline, and cortisol levels, then the caffeine in our coffee or, tea or whatever it is going to contribute to that as well. And then alcohol. So this is where I have to make a little admission. This was a big factor for me. I would drink a glass of wine or two a night, while I was cooking dinner. It was just kind of a way to relax. And this was a huge anxiety factor for me that had slowly crept up through the years. I didn't realize it. But I had, been drinking pretty much a drink every day. And so I didn't realize how it would decrease when I stopped drinking. And at some point, I will share that story. But that was a God ordained mandate that I was not allowed to have alcohol for 6 weeks. And by the end of that 6 weeks, my anxiety level had dropped by probably 80%. And I was like, wow, that's amazing, because I remember feeling like this is my calm, normal feeling. And it was back or almost back. And so alcohol was a big one for me. So if you indulge regularly, and it doesn't even have to be a lot, like it was a glass of wine, sometimes more, but at least a glass of wine a day. And so if you're drinking a glass of wine a day, or maybe even 3 or 4 times a week, that might be too much for your body. So just something to keep in mind there. And then the last is a little bit less scientific, but clinically, I've seen this over and over and over again. And these are food sensitivities. So for me, tomatoes and corn cause severe depression if I eat too much of it. And eggs and corn cause anxiety. So for me, I know if I eat too many eggs or I eat too much corn, I'm going to start feeling anxious and depressed. It's a super fun combo if you've had that. So you're going to have your own possible food triggers. So this is where, again, keeping an anxiety journal or, noting when your anxiety spikes, when it's really bad, starting to understand, okay, well, I had quite a bit of, dairy or gluten or whatever the case may be. And if you're starting to notice those patterns, maybe you cut those foods out for a little bit and see how you feel. You might feel better, you might not feel better, but you can give it a try. All right, so let's move on to ways that we can treat anxiety. And I know this is the part that you're really looking forward to. If you struggle with anxiety, you want to know, well, that's great. Good information. What do I do about it? So there's the typical conventional treatments, right? There's the medications, the SSRIs, benzodiazepines. There is antihistamines. There's a ton of medications that can be utilized for helping with symptom relief. And while that can be helpful in the short term, it does not address any of the root cause issues. So if your anxiety is being caused by hormone imbalances, it's not going to help that. If it's being caused by nutrient deficiencies, it's definitely not going to help that. It's probably actually going to compound the problem. So the problem with medication is that, number one, it's forcing our body into a state that it's not supposed to be in. And while that's okay acutely, That's how we want to use medications that we need acutely. We don't want to use it to just mask the symptoms and continue on our merry way 20 years later. Because if we have unaddressed imbalances when we're in our, 20s, how much worse is that going to be in our 40s when we're now struggling with our hormones becoming dysregulated and the increased stress from the last 20 years and all of those things, right? And so we really want to make sure that we're diving into what is causing my anxiety while I'm taking these medications to help me feel better in the short term. So you should have a discontinue plan in place. If you go on these medications, you need to talk to your doctor about how long am I going to be on this for? And how am I going to get off of them? Because the longer you're on some of these medications, the harder it is to come off, and the worse it contributes to detox issues, liver issues, mitochondrial dysfunction issues, which I've talked about in previous episodes. And those can contribute to chronic pain syndromes, things like migraines and chronic headaches, hormone imbalances, fatigue, all of that. So, again, these are short-term solutions. These are not long-term solutions. So we want to make sure that we're having that conversation with our doctor and we're talking about, all right, how are we going to address the underlying issue? And you might need to seek a functional health doctor or a naturopathic doctor to help you figure that out, because that's not really how conventional doctors work. So, one of the reasons that medications are not always successful is because there's a bunch of different types of medications that work on different neurochemical imbalances. So, if you're having an issue with low GABA and they put you on an SSRI that affects serotonin, you might not notice any effect there. And so, it's kind of a guessing game, right? You want to try one medication, see if it works, and switch to the next, switch to the next. And that's typically how they give you 6 weeks on one, then another, and then another. And so that's great. Like, that's the only way to really prescribe it. Well, we have kind of an order of the medications that we look at. We give you one. If you fail that one, we give you the next one. If you fail that, you give you the next one, and on down the list. But what's that doing to your current brain chemistry, right? As you're switching around and you're boosting serotonin, and now you're boosting GABA, and now you're trying to decrease glutamate, and how is that affecting that underlying imbalance in the first place, right? So just something to consider. So there was an interesting study that stated, given the chronic course of anxiety disorders, it is regrettable that there are almost no controlled studies that investigate treatment periods over 12 months. So they might want to keep you on it for 10 years, but we don't know what the long-term issues are going to be because there's been no actual studies done, right? And so a lot of times I've seen patients come back in and say, well, it used to work, but now it's not working anymore, but now I can't stop it because my body is dependent on it. And so then not only do we have to deal with the original imbalance, but now we have to deal with the medication-induced imbalance as well. And so that just kind of compounds the problem. So all things to think about, not to make you afraid of pursuing medication if you need to, but it should not be the end all be all of treatment. So let's talk about some of the other functional and holistic tools that we have. So we have diet, as I mentioned. We want to work on stabilizing our blood sugar. We want to eliminate processed foods, fast foods, convenience foods. So we have to balance this with our stress management, right? We have to take a look at how we can maybe prep, maybe get the family involved. You can have one weekend once or twice a month where you guys do family prep meals, and you take 2-3 hours together. You make 5, 6, 7, 8, 10 meals, whatever, that can then easily be pulled out, put in a crock pot, instant pot, something like that, so that you have a quick pre-prepped meal to go without having to spend hours in the kitchen every day. And I've done that with my family. It works wonderfully well. I have probably at least 10 or 15 pre-made, ready to go, instant pot frozen meals in my freezer. So when I have, oh, shoot, I forgot to plan for dinner today, we have football tonight, I can grab something out, throw it in the instant pot. By the time I get back from practice, it's meals ready to go. So that can be really helpful in eliminating processed foods, incorporating family time, and then you guys just put on some music and you just have fun together. Want to eat breakfast before we have our coffee. We want to balance our fat intake with our sugar intake and cut back on alcohol and caffeine. Okay, so those are some of the dietary things. And then investigating some of the food sensitivities that you might have as an individual trigger. There are certain supplements that can be helpful. So magnesium, specifically the forms magnesium glycinate or magnesium threonate, have been shown to help impact anxiety levels. Vitamin B6, B12, and folate can be helpful. Although you do have to be careful with the form of B12 and folate because there are certain forms that can actually worsen anxiety if it's dosed too high based on your genetic makeup. There are supplements for GABA and L-theanine that can help balance neurotransmitters. 5-HTP is another one that can be helpful in the serotonin piece. And then we've got omega-3 fatty acids. There are so many people that have very little omega-3s and too many omega-6s. Omega-6 very inflammatory, omega-3s are anti-inflammatory. And we tend to be very imbalanced towards the omega-6 pathway, and that can again contribute to the anxiety. So we want to bring things back to the omega-3 side. And so supplemental fish oil can be helpful, as well as adrenal support. So these are herbs that can help to reduce our cortisol output. So things like ashwagandha, rhodiola. Now, one caveat that I do want to say is that you cannot start a supplement if you are on medication without talking to your doctor first, because a lot of the supplements for anxiety work on the same pathways that the medications for anxiety work on. And so if you're taking something that, say, an SSRI that works on serotonin, and then you start taking 5-HTP, you can cause your body to go into too much serotonin production, and you can actually die from it. It's called serotonin syndrome. So these are not to be lightly taken and just, oh, whatever, like supplements, yeah, fine. No, like I've actually had people come to me, they've tried it on their own and they've ended up in the hospital as a result. So when we're dealing with neurotransmitters and medications, you really need to make sure that you clear any supplements that you start with your doctor before starting it. So that's my little caveat for this episode. All right, so then we can look at lifestyle things. Sleep hygiene, so making sure we're getting up and going to bed at the same time every day, that we're sleeping without any lights in our bedroom, that maybe an eye mask or what have you, that we don't start or we stop watching TV or being on our phones for at least an hour before bedtime, things like that, right? Breath work, so working on deep breathing, kind of monitoring your heart rate variability. You can spend 5-10 minutes every day just monitoring how your heart rate changes based on your breathing in and out. And that actually can help to train your body to engage in those parasympathetics. And then we can also look at what's known as vagal nerve activation. So this is the vagus nerve is what is mainly responsible for our rest and digest mode. And so we want to activate it. We want to turn it on to help keep us in that calm space. Things like humming, singing, cold showers, all of those have been shown to increase vagal nerve action. And I find this really interesting. There's a reason that we're supposed to sing praises to God. It helps to activate that calming, relaxation, rest and digest mode. So go sing some gospel music out in, the backyard while you're doing some gardening or something. Like wonderful ways to kind of relax and bring down that anxiety stress level. And then we want to make sure that we're investigating and addressing root causes, right? Our thyroid, our adrenals, hormones, microbiome health, our gut health, detox pathways, genetic variances that can lead to imbalances in our hormones and our neurotransmitters. So there's a lot of things that your doctor can work with you to investigate. All right, so finally, and perhaps I've saved the best for last, is we want to take a look at, what does all of this mean spiritually? How can we utilize our spiritual health, our relationship with God, to help change our physiology? So there is a ton of research about how our healthy relationship with God, and what I mean by healthy is, that we have a relationship, number one, that we turn to him for help, that he guides us, that we're in scripture regularly, right? That we don't look at him as a fearful, vengeful God or someone that we've been taught to fear, but instead a loving father who wants us to heal, right? When we have addressed any of those doubts or misconceptions about who God is and what he wants for our life, that can go a long way to resolving some anxiety. We didn't even touch on, I have another episode coming out in the next few weeks on PTSD. And so that's very closely related to anxiety. So I didn't want anybody out there thinking that I've skipped over the traumatic pieces that can contribute to a lifetime of anxiety, childhood traumas, or even adult traumas that can contribute to imbalances in our body. So that's coming out in a few weeks. And so make sure that if that's something that you're interested in hearing, that you subscribe to this podcast or to the YouTube channel, depending on where you're listening to this, to make sure that you get notified when that episode is released. So we definitely want to acknowledge that there is going to be a trauma piece that affects a very high number of people with chronic pain, like something like 80% of people with chronic pain, chronic conditions, fibromyalgia, migraines, things like that, linked to childhood traumas. And so just in the general population, we've all been through things that were traumatic. And if our body has not been able to fully process that, if our mind has not been able to fully process that, we're going to be stuck in a place that we need to work through. And so having a relationship with Jesus and understanding that, he tells us to take every thought captive to obey Christ, right? 2 Corinthians tells 10:5. And scripture reminds us over 365 times, do not fear. So God knows that we struggle, but he also knows that he can help us through that. And so it's not a matter necessarily of just praying more. Praying absolutely should be part of it. And we can pray that God would remove this burden from us, but he doesn't always do that, right? For whatever reason, he doesn't always do that. He wants us to learn how to care for our bodies the way that he wants us to. And so this is one of the ways that kind of digging a little bit deeper and doing those anxiety, those symptom journals that I keep talking about, that can be really a wonderful way for us to figure out physically the things that we're doing that is not helpful for our body, as well as working spiritually to talk to him and have him guide us through these things, right? And so, like I said, God was the one who told me I needed to give up alcohol for 6 weeks. And I actually had to do that twice. And then now I understand, it had a hold on me, not just physically, but spiritually as well, right? It was an idol. And again, I'll talk about that in future episodes. But, one of the things that we've talked about in the first couple of episodes of this season is doubt and questions that we have. So there are actually, again, quite a few studies that show that unaddressed doubts about God can contribute to anxiety, depression, and some emotional imbalances. And so just take a look. Just do some inward thought. That's why this episode is number 4 of this season, is because we just got done talking about doubts and how they affect our body, doing a little bit of introspection to see what kind of doubts we might have, questions that we might have about God, and giving you permission to start exploring those. So if you come up with anything, and especially if you feel like this might be a key piece to your underlying anxiety, feel free to share them. You can either email me privately, or you can, leave a comment in the comment section here. But there are a couple of scriptures that I really want to share with you that did a lot for me. And so, probably not surprising for many of you, Philippians 4:6-8. So I'll read for 4, 6, and 7. The Lord is at hand. Do not be anxious about anything, but in everything by prayer and supplication with thanksgiving, let your requests be made known to God. So he's inviting us to tell him what we're being anxious about and to listen for guidance on that. And one of the things that I am sure to do every day now, and when I'm praying to kind of start my day, is I ask the Holy Spirit to fill me and to give me the peace of God, which in verse 7 surpasses all understanding and will guard your hearts and your minds in Christ Jesus. And so I invite the Holy Spirit into me every day fresh, and ask him for that peace. And I feel it wash over me. And so, again, this is something that I've worked on for the last 3 years, and I can just feel an instantaneous relaxation that happens as a result of that now, right? And it only happens when I'm actually intentionally asking God for it. He's so faithful to give that when we ask. So maybe try that. It didn't happen immediately. It was not something where it's like I asked for it and I was immediately blessed with that. Fantastic if you are, that's wonderful, and I'm jealous. But I just persisted, and as I worked on these other things, right? Like he saw that I was very serious about this. And so he met me where I was at, and he didn't make it easy for me. Like he needed me to see, it's important that you give up alcohol. It's important that you work on your diet. It's important that you do these things. And yes, I'm also here to support you, but I'm not going to make it easy for you necessarily. I'm not going to give you the easy way out. He's not a genie. As I've said before, I used to think of him as a genie, like cure me. If you can't cure me, what good are you? Sorry, God. But, that's kind of how I thought. So my attitude towards him changed as a result of some of the struggles that I went through. And so just something for you to consider if there's any unconscious attitudes that you have about God, about his ability to answer our prayers, about his willingness to answer prayers. When we're stuck in physical health issues and we don't get delivered from them, as Paul, struggled with the thorn in his side for, prayed 3 times, it was never taken from him. And then he realized that God was made perfect in his weakness. God's strength is shown through our weaknesses. And that was the story for me as well, right? Like I saw how he was working, but it took time for me to focus on him and understand why he was allowing me to go through that. So then, one of my favorite verses of the entire Bible, Philippians 4:8, I've shared it before, I will share it again. Finally, brothers, whatever is true, whatever is honorable, whatever is just, whatever is pure, whatever is lovely, whatever is commendable, if there is any excellence, if there is anything worthy of praise, think about these things. What you have learned and received and heard and seen in me, practice these things, and the God of peace will be with you. And so this really comes back to kind of prioritizing our day, what we're choosing to focus on. Are we focusing on him through the day, or are we constantly thinking about the next task, the next thing to do, the next, the next, the next? Because those are not always pure and lovely. They're just things that we have to do. And so taking that time to just stop and realizing that if I'm 5 minutes late to pick the kids up, it's going to be okay. If I don't get the shopping done today, maybe it'll be fine, right? So there are things that we can do to kind of let go and spend more time with God. And so one last point I'd like to make with that is meditation. So meditating on scripture. And so I really quickly want to talk about meditation. And again, this is a topic that we'll talk about in the future because I see a lot of Christians that say meditation is evil, meditation is, idolatrous. It's from different religions. Meditation actually means to think on. That's all it means. We don't have to assign some spiritual meaning to it. Meditation simply means to think on. And so if we choose to meditate on the word, it means that we're thinking on the word, we're thinking on scripture. And so what I would encourage you to do is figure out scriptures that speak to you, that bring you peace, that really talk into your life where you're at now, and write them down and carry them everywhere with you. And set a timer on your phone, set an alarm, put sticky notes in your car, however it works for you. And just every time you see it, stop for a minute, think about it. What does that mean to me? What does that mean to me right now? What does that mean to me in my life where I am? What is God trying to speak to me through these words? And just think on it for 2, 3, 4 minutes, right? If we do that once an hour, then how many times have we connected with God through the day? And it takes a couple of minutes. So we really want to learn to connect with God through our busy day. And that's still something that I struggle with. I get to work and I start thinking about all of these different things. And next thing I know, half my day is gone and I haven't checked in with God once. So I struggle with it. We all do. Life takes over, but we just we need to constantly work on reminding ourselves and taking our thoughts captive and focusing on what is good and holy and pure and lovely. So, as we wrap up this episode, I want to remind you that anxiety is not just mental. There is a biochemical piece, there's a hormonal piece, most likely, and there can be a spiritual piece as well. But there is healing in both our God and also naturally. He has given us means to address our body, our imbalances, and things that He knows that are going to come up as a result of living in a fallen world. So I have a free gift for you. It's called 10 Tools to Calm Anxiety Biblically. And we'll go over some of what we talked about, just a kind of a little cheat sheet for you as far as the things that we want to start tracking so that we can start to analyze what the root cause of our anxiety might be. And then it also includes things like suggestions for spiritual practices, natural tools like some of the supplements that we have available to us and how they might work. Um, Including a 5-minute morning and evening routine, prayer prompts, things like that. So I'd encourage you to download that and if you would find that useful. And I invite you to share this episode with somebody else that you might know who's struggling with anxiety. And if you found this helpful, I would love to have you follow the podcast as well or subscribe to the YouTube channel so that you can get notified of the new episodes of The Christian Clinician. Until next time.
Thank you for listening to our podcast. Please subscribe for more topics like this, where we focus on bringing our faith and health together for a whole you. If you have questions around your health or your faith, including doubts and struggles with what you've been taught about God, we'd love to have you send us an email at support@psalmmedical.com.